Hello, friends. Now we will talk on fasting mimicking diet for diabetics. I am Dr. Jagajit Singh Virk, MBBS, FCGP, FMS, PGDGM. Diabetic diet. The fasting mimicking diet has shown potential benefits for metabolic health, and there is growing interest in its use for individuals with diabetes mellitus type 2. However, for individuals with diabetes, special precautions and careful monitoring are necessary due to the potential impact on blood sugar levels, insulin sensitivity, and overall metabolic function. Here's a detailed look at how the FMD can be adapted for individuals with type 2 diabetes, along with special precautions to be adhered to. FMD for diabetes mellitus type 2. Key principles. Number one, low calorie intake. The FMD typically consists of 800 to 1100 kilocalories per day for 5 days, which is low enough to trigger beneficial metabolic changes such as improving insulin sensitivity and promoting autophagy, but still sufficient to avoid severe hypoglycemia. Low carbohydrate, low protein. FMD reduces carbohydrate intake to levels that prevent significant spikes in blood glucose levels. Protein is also kept low to stimulate autophagy and support fat burning without overburdening the kidneys or disrupting insulin levels. Number three, healthy fats. The diet emphasizes the consumption of healthy fats such as olive oil, coconut oil, avocados, and nuts. These fats help maintain energy balance and induce ketosis, where the body uses fat as a primary energy source instead of glucose. Number four, intermittent fasting, mimicking benefits. By reducing caloric intake over several days, the FMD mimics the effects of intermittent fasting, improving insulin sensitivity, reducing inflammation, and supporting weight loss, all of which are beneficial for type 2 diabetes mellitus management. Improved benefits of FMD for type 2 diabetes, improved insulin sensitivity. The FMD may enhance the body's ability to respond to insulin. Studies suggest that intermittent fasting and low-calorie intake diets improve the insulin sensitivity by lowering blood glucose levels and reducing insulin resistance. FMD can help reduce insulin secretion, which may be beneficial in managing the hyperinsulinemia, that is high insulin levels in the blood, often seen in type 2 diabetes mellitus. Reduced inflammation. Type 2 diabetes is often associated with chronic inflammation, which contributes to the development of insulin resistance. FMD can reduce markers of inflammation, potentially improving overall metabolic health. Weight loss. Weight loss is a crucial factor in managing type 2 diabetes. FMD may promote fat loss and help reduce visceral fat, that is fat around the organs, which has a direct impact on insulin sensitivity. Improved blood glucose control. The low calorie and low carb nature of the FMD can reduce the fluctuations in blood glucose levels, leading to better control over the condition. Cellular repair and regeneration. FMD promotes autophagy, the body's natural process of cleaning out damaged cells, and thus could help improve overall cellular health and function. which may benefit organs affected by diabetes, such as the liver and pancreas. Reduced risk of complications. Regular use of FMD may help lower the risk of complications associated with type 2 diabetes, such as cardiovascular disease, kidney disease, and neuropathy by improving metabolic health. Special considerations and precautions for diabetes patients on FMD. While FMD can be beneficial for type 2 diabetes, there are several important precautions and considerations to ensure safety. Number one, monitoring blood glucose levels. Frequent monitoring of blood glucose levels is essential, especially during the first few days of the FMD, since FMD may lower blood glucose levels. Individuals with diabetes are at risk for hypoglycemia, low blood sugar, particularly if they are on medications such as insulin or sulfonylureas that stimulate insulin secretion. Self-monitoring should be done at least 3 to 4 times a day, especially when starting FMD, to identify any sudden drops in blood glucose levels. Number two, adjusting medications. Consult with a healthcare provider before starting the FMD to adjust medications, especially insulin and oral hypoglycemic agents. Insulin doses may need to be reduced during the fasting period to prevent hypoglycemia. Sulfonylureas, which increase insulin secretion, may need to be adjusted to avoid excessive insulin release. Some individuals may be able to reduce their medication dosage if they experience better blood sugar control during the FMD cycle. Hydration and electrolyte balance. Fasting mimicking diets may cause dehydration due to reduced carbohydrate intake, which stores water in the body, and the diuretic effect of ketosis. It is important to maintain adequate hydration by drinking plenty of water and consuming electrolyte-rich foods, that is leafy greens, avocados, coconut water, to balance sodium, potassium, and magnesium levels. Gradual introduction. For people with type 2 diabetes, it is advised to start slowly and adapt to the FMD. It may be helpful to begin with a modified approach that includes slightly higher calorie intake for the first cycle and then progressively lower the intake, one cycle at a time. Begin by following the FMD for 5 days in a controlled, supervised manner, and then assess its effects on blood sugar and overall well-being. Meal timing and frequency. Intermittent fasting patterns such as 12 to 16 hours of fasting may be incorporated along with the FMD. Meal frequency should be adjusted to prevent large insulin spikes after eating. FMD may be followed with smaller, more frequent meals or a slightly longer fasting period to avoid overwhelming the pancreas. Ensure the diet is balanced with healthy fats and moderate protein while keeping carbs low. Avoiding nutrient deficiency. Since FMD is a calorie restriction diet, micronutrient deficiencies, that is vitamin D, B12, calcium, can become a concern if followed too frequently. Supplementation may be necessary to ensure that individuals are getting sufficient vitamins and minerals, particularly if they are on a strict FMD regimen for multiple cycles. Personalization. The FMD should be personalized to each individual's needs, preferences, and medical status. People with type 2 diabetes often have comorbid conditions such as hypertension, dyslipidemia, or cardiovascular disease. which must be considered when designing the diet. Potential contraindications. Pregnant or breastfeeding women, children, and individuals with severe heart, kidney, or liver disease should not follow the FMD without strict medical supervision. If an individual has severe complications from diabetes, such as diabetic ketoacidosis, DKA, or uncontrolled hyperglycemia, FMD is not recommended. Sample modified FMD plan for type 2 diabetes. Day 1, higher calorie intake, that is 1100 kilocalories. Includes breakfast, 1 boiled egg with 1 tablespoon of avocado oil and a handful of spinach cooked in olive oil. Lunch, grilled chicken breast 100 grams with a large green salad, lettuce, cucumber, olive oil, and lemon. Snack, a small handful of almonds, 8 to 10, and 1 teaspoonful of coconut oil with herbal tea. Dinner, fish curry, that is tilapia or salmon, with steamed cauliflower and 1 teaspoon of olive oil. Day 2 to 5, lower calorie intake includes 800 kilocalories. These include breakfast chia seed pudding with unsweetened almond milk, cinnamon, and stevia, low carb sweetener. Lunch contains methi fenugreek soup with boiled chicken breast. Snack, a small handful of walnuts or flax seeds. Dinner, stir-fried shrimp, 100 gram, with mixed non-starchy vegetables like zucchini and bell peppers cooked in coconut oil. Key adjustments for type 2 diabetes mellitus. Reduce carb-heavy ingredient like potatoes, rice, and high-sugar fruits. Increase non-starchy vegetables like spinach, cauliflower, and zucchini. Focus on lean proteins, chicken or fish or eggs, and healthy fats like olive oil, coconut oil, avocado oil. Avoid any refined carbs and sugary foods. Conclusion. The fasting mimicking diet offers a potential tool for improving metabolic health and insulin sensitivity in individuals with type 2 diabetes. However, it requires careful supervision, frequent blood glucose monitoring, and potential medication adjustments. Always consult with a healthcare provider before starting the FMD, particularly for those on diabetes medications. Proper hydration, nutrient supplementation, and individualized planning will ensure that the benefits of the FMD are achieved safely and effectively. Thank you very much.